Uh, I'd like to keep this kind of informal. I've got a PowerPoint I'll share, but I would love it if you guys would, if you have a question or comment, please throw it out. I would love to entertain questions, comments as we go along. So please don't be shy as we move forward. Let me share my screen here. So it'll let me, can you guys all see this? Is it not letting me share from the beginning? Come on. Oh, here we go. Okay. So, and as an introduction, a little further about myself. So, I experienced the loss of a spouse, my wife, in 2003, and then later in 2009, I lost a daughter to cancer. And so the book that was mentioned, The Dragonfly Wings for Emily, is kind of it's about her life, what she went through, but also my experiences as a therapist and a clinician of what I experienced. And I experienced grief and loss and how I applied it to individuals that I was working with at the time and how I changed my approach after I experienced these two losses with grief and loss. And I'll share with you, and I have this based upon research as well, not just my own thoughts or feelings. I've done quite a lot of research about this topic, so wanted to share with you um, some of the things that I experienced and also the research that I've dug up. So first off, and and I'm not going to go through each of the bullet points. I don't know that they're that helpful, but I will explain what all this means in my own words. So I've had personal experiences. I've had a variety of surgeries and things, and when I get out of the doctor's office, they all say to it, well, here's your recovery time. You got 4 to 6 weeks to recover. And, we're used to that. That's the medical model. That's how doctors, nurses, hospitals, they speak to us in those terms of this is the average time that it takes someone to recover. But there's always those people that recover faster than that. And then there's always those people who never get better. They experience some reduction in symptoms from a surgical procedure, for example. But they always have some lingering pain or something lingering continuing to go on. And so for those people, it's not helpful for them to feel that they're this outlier, that they're the person who doesn't fit within the 4 to 6 weeks recovery. And what I noticed with grief and loss, and I talked to a lot of clinicians about this, and a lot of clinicians will say, oh, about a year and a half, you'll feel better. You'll experience a reprieve in symptoms and things will be better. Some people don't. Some people do. Some people don't experience a lot of grief, the pangs of grief that are so familiar to all of us. And some experience a lot, and some go through a lot of challenges, and it digs up a lot of things for them that is not maybe your typical. So I always tell clinicians, I train clinicians on how to deal with grief and loss as well, that when you're dealing with yourself or anyone who has experienced grief and loss, to never give time frames. Don't say that you're going to fit within some medical model and that those time frames are going to be a certain way, because it always sets certain individuals up for frustration. And the next slide, I'm sure all of us have heard about Kubler-Ross. If you haven't, you've probably heard of the 5 stages of grief and loss, or 5 stages of loss. It's in our face all the time. I hear it on the media all the time. I hear it in a lot of different contexts that people go through 5 stages of grief and loss. And The stages are from Dr. Kubler-Ross, who developed actually a model for those that were dying, not those who experienced a loss. So Kubler-Ross's model of denial, anger, bargaining, depression, and acceptance, those are the 5 stages that she developed were for those who were going through a terminal illness. And she was a psychiatrist, so she's approaching this from a medical model. And so those 5 stages were adopted as the stages of grief and loss. And, wrong, right, bad, good, whatever, that is what is in our face all the time in our society is 5 stages of loss. And it's a medical model. And it doesn't fit for all people. It is it's for some. But when we're trying to average people's emotions together, if we say, okay, here's 50 people who have gone through a loss, and those 50 people, about 40% of them experienced some depression, 10% of them experienced anger, 5% of them were bargaining, and everyone eventually gets to this acceptance stage that we'll talk about. But you don't stay in acceptance. So not add denial, anger, bargaining, depression, acceptance, and say, okay, this is the average feelings that people are going to have when they experience a loss, because that really sets people up for frustration and wondering if they're doing something wrong or if they're not grieving properly. So my experience and research is that we can look at these stages as a possible, but not adhere to them as something that everybody is going to experience or go through. And this slide is really about how we diagnose bereavement. And I just wanted to share with you guys a simple thing relating to this without all the fluff of this, is that as we look at bereavement issues, everyone is going to experience some sort of that's if there's one feeling that I would say most people have, and I'm not saying that 100% of people have it, because I've met some people who are like, no, yeah, I'm kind of glad that that person died. It was their time to go. They were suffering so bad in this life that I'm really kind of in a place where I'm accepting of that, and it's a good thing for them. And that is some people, but I would say a high percentage of people experience, even those people, if you really dug into it, you'd say, yeah, they have some sadness because there's a loss there. A person in their life has died, and they are going to miss that person. They're going to miss everything about that person. So I would dare to bet that everyone to some degree experiences sadness. But we never say that people are depressed because of bereavement issues. And I'll talk about that a little bit later, kind of the difference between bereavement and depression. But I wanted to throw that out that if you experience some depression, it's pretty normal when you lose somebody, a loved one that's close to you. So here it is, depression versus bereavement. And what we look at, and what I'd like you guys to look at, is what are those feelings that you have, and are those feelings, how strong are they? What is the intensity of those feelings? And are you preoccupied with this to the degree that you have an inability to function properly? So that's where we're looking at, okay, there might be some issues we want to take a look at in a therapeutic type of setting. If there's some things that are persistent, that are lingering on, and inability to process through some of those things. And so we look at this one here, the positive emotions. Usually people can still access some sort of positive emotion. associated with the bereavement. So, meaning that people can still see positives in their own life and they can see positives from their loved one. That it's not just a focus of doom and gloom and all is negative, all is lost. So we look at those things. If you're on the opposite end of that spectrum, then you might need some therapeutic support to be able to help through some of that. If your thought process is self-critical or pessimistic, or your self-esteem is affected by the loss, um, and you're experiencing these feelings of worthlessness that lead into depression, then you might need some clinical support to help process through some of that. And then obviously, if there's some suicidal thoughts, thoughts of wanting to join the loved one, then definitely we want to take a look and say, yeah, let's get some support for that person, because we don't want that to affect someone to the point where they're considering taking their own life. So um, and there are types of loss that tend to affect us differently. So all losses are not created equal. Um, so, but some people, individual differences can be applicable to the different types of losses. Not everyone is going to experience the loss of a job the same way. If there's been multiple job losses, then obviously, though that intensifies those feelings and may intensify some of the reactions that might be forthcoming in relation to that. Same thing with divorce. If there's been multiple, or if this divorce was really hard on someone, which sometimes is the case, then that can be very difficult. But there's all sorts of losses that we can be presented with, and we all deal with them a little bit differently. The ones that I found, there's a book called The Greatest Loss, as I read after I lost my daughter's. My daughter, someone came to me and gave me that book, and it was about the different types of losses that people experience. And what these authors summarized was that the death of a child was a very difficult loss, and suicide and murder and accidents were some of the more difficult losses to deal with. And in fact, they surmised that suicide was one of the more difficult losses to deal with because of the persistent feelings of questioning yourself, questioning, could I have done something different? And the guilt that could be associated with that. Why did they do that? Because it's an unanswered question of why someone did that, because we can't ask that question. And so, uh, uh, but again, my message is that everyone experiences losses differently. There's no one way to experience a loss, and no right or wrong way to necessarily grieve a loss. Um, so we look at what's out. I mentioned a couple of this. So let me go into a little bit more detail. What's out of the norm? So, as I mentioned, if someone is having thoughts of suicide, if someone is really down on themselves, and their sleep or appetite, their family is being affected, their employment is being affected, social relationships are being affected. We look at that in the field as saying, okay, functioning is being impacted by this loss or by something. And if it is too bad, too much, too intense, of sleep, appetite, family, social, emotional, employment issues, then we want to wrap around that person with some support. Um, so, so outside of the norm, what we look at is the pains. Everyone is going to experience to some degree the pangs of loss. Um, And that is normal. And to experience, I would say, a wide range of emotional responses is pretty normal. To feelings of shock when that person, when the loved one passes away, intense kind of swings of emotion are pretty normal. When having some sleep and some appetite disturbance is pretty normal. Having some irritability is pretty normal for people. Having some of the sadness that we talked about, and persistent sadness, and understanding that intensity of the feelings can come and go, and those kind of pangs of grief or the waves of grief are pretty normal and natural for people to experience. The tide comes in and the tide tends to go out. We experience really intense feelings when we have a memory of our loved one who's passed, good or a difficult memory. We experience that, but those feelings don't last for lengthy periods of time in a normal process. We move in and out of those intense emotional responses, and are able to come back to somewhat of a normal type of functioning. I have noticed that there are some cultural norms that some cultures grieve very outwardly, very loudly, and that is very normal. And other cultures would look at that and say, "Wow, that's really outside of the norm." And so that's just one example of some cultural norms that we would look at and say, again, someone looking at someone from a different culture who's grieving very outwardly and loudly, and say that's over the top. But for that person who comes from that culture, it's pretty normal for that. Or someone who suppresses their feelings and doesn't really express much, we might say, well, that's abnormal that that person is not saying anything about it. And it baseline, that person experiences the world without a lot of emotional responses. And so we do need to look at individual differences and cultural norms. Substance use, increased substance use in relation to a loss is always something that is a red flag. We don't want to see that. We don't want to see any increase in substance use, because that could lead down a path of further problems and further challenges for individuals. Some of the things to look at for individual losses is how long ago was the loss, how close the person was to the loved one who died, because closeness does impact grief. Obviously, I mean, I think that's pretty normal if you were very close to someone to experience those intense pangs of loss. But I had noted an interesting effect in our culture and in the I don't know, entertainment industry, I guess, is that when a celebrity dies, you see an outpouring of love towards that celebrity, even though they personally didn't know that celebrity. And I see this more in music, I guess, the music industry, because I think people feel like they knew that person who is a musical artist because of their music, and so they felt a close connection to that person. And so when that celebrity dies, we see this really, and so that is one thing that is um, not your norm, but it is a norm in relation to our culture, that people who didn't really know someone on a personal level, but knew somebody based upon their work, their book, or their films, or their music, that they have a very intense reaction to that type of loss. So we don't look at that again as, okay, that's outside of the norm or that's abnormal. It's something that happens in our culture. And as long as you don't get those things that run outside of the norm, then we say, okay, that's pretty normal. How many losses affects us? If someone has multiple losses over a short period of time, that's going to cause more difficulty for that individual. And so if, and even just multiple losses in general, it doesn't even have to be necessarily over a short period of time. Just multiple losses in general can create more difficulties and more pangs of loss and more challenges potentially for that individual. Religious and spiritual beliefs come into play as well. And research suggests that those people who have a belief of an afterlife um, tend to deal with grief very differently than those who um, believe in no afterlife. And those who have a belief in an afterlife tend to have a more minimization of pangs of loss because their belief is that they will potentially see that person again. Where those who don't believe in an afterlife, that's it. I'm not going to see this person again. And so there could be some association of increased loss or increased intensity of feelings um, with not having those type of spiritual beliefs. Psychiatric illnesses before the loss, these can and do, I see it, they do resurface when there is a loss. And so just being aware of that for yourselves, if there is any, and sometimes I would say even physical illnesses can exacerbate, because we all know that stress can exacerbate physical or emotional problems. And so just being aware that if you have depression and have had it in the past, that there is a chance that that depression may resurface after a loss, and being able to um, manage things maybe a little bit differently, being a little more proactive with things because of a history of depression might be a better case scenario for those individuals. If people have been on medication or are currently on medication, that certainly can play into factors as well. And so those individuals who are managing their psychiatric conditions with medications may deal with a loss a little more effectively. For those who have stopped medication, it could be that those medications may need to be restarted again after a loss, but it's not a guarantee. I'm not saying that has to happen, but it is a consideration to look at. Substance use before and after the loss, again, as I said, if there's an increased amount of substance use, we definitely want to have some wraparound support for that individual. I've already talked about that. Current health problems before and after loss. It can be exacerbated, as I mentioned, because of a loss. Sleep, appetite, social, employment, family. Those are our bread and butter things that we look at for functioning in the field, and we want to make sure that those aren't impacted so intensely and such a wide spread. If someone goes for days without eating, that's going to be a bit of a problem. We're going to see some challenges as a result of that. If someone isn't sleeping well, days go by and they're not sleeping, we want to address that. And so sometimes it's either therapy, learning some sleep hygiene techniques might be helpful. If social relationships are impacted, having a therapist work on those social relationships. Employment is impacted, working on what is the impact and how to better those relationships at work. So those are just all considerations to look at in relation to a loss. If this thing is significantly, we want to take a look at that. Trauma. So trauma means PTSD is post-traumatic stress disorder. And that happens sometimes as a result of a loss, especially if it's a traumatic loss. We can have some trauma develop in individuals. And trauma means that those individuals would experience nightmares or flash loss and a startle response in relation to loss. So, meaning sudden movement, sudden sounds, sudden smells can exacerbate the startle response in people. And that could mean that you're leading towards a trauma or PTSD type of response to things. And definitely in those situations, we want to take a look at that and make sure to address this. Some of the things to consider is the times of day for individuals that are worse than others. So for some people, the morning is the worst time. For some people, nighttime is the worst time because they tend to wake up, first thing on their mind is that loss, or at the end of the day, they can't go to sleep because the loss is on their mind. And so identifying those times of day that are worse than others helps us solve the problem. Identifying triggers, the smell, songs. I mean, I think everyone has, things that they associate to that individual. It could be smells, songs, places, people, things. Um, and when those triggers arise, we tend to have an emotional response to those triggers. And that's not bad. I mean, I think in a lot of ways that's a good thing, as long as those triggers don't cause us to have a decline in functioning or an increase in substance use, those type of things. Looking at support systems is really vital to make sure that you've got adequate amounts of support around you, because I will tell you, many people will say this is, the first few weeks you get an outpouring of love from people around you. You get the cards, you get the comments and concern, and then after a few weeks, that support kind of tends to drop off. People unfortunately go back to their lives, and I've had many people say to me, "Man, what happened to the support? What happened to all those people who were expressing the goodwill and the support and the good wishes?" And some people feel very lonely after those 2 weeks and feel very let down by that. So being aware that after a new loss, you may experience some of that, and reach out to those really core support systems in your life to gain that support from them, and identify that uh, that they're aware of what you're going through, so they can help be in a place to be able to support you. We talked about the cultural considerations. One of the things I noticed is people will, family, friend, neighbors, and they all mean well. I know, I don't believe that anyone has malicious intent when they come up to someone who has experienced a loss. But some people say things that are, not your cup of tea. Say things that kind of rub you the wrong way or go against the grain. And everyone has experienced that to some degree, where someone may say something to you and it's like, no, I really didn't need to hear that. That is not helpful at all, to hear those words. And being able to be assertive enough to say that, or to just let it go and realize that people are going to say things because they just really don't know what to say. And I've heard stories of people that have lost somebody, and they're walking down the street, and the neighbor, someone is walking towards them, and maybe not purposely, but they feel like purposefully cross the other way or turn around and walk the other way because they don't know what to say to that person who has experienced loss. And so they end up just avoiding that person. And I've had a lot of people tell me that they get this kind of avoidance from people. And it's not because they don't care, it's because they just don't know what to say to people. And it is a difficult thing to know what is the right thing to say to people. So I think sometimes when we have someone say something to us that kind of rubs us the wrong way, is probably best thing to do is just realize that and try to let it go the best we can. Feel like it's really strongly outside of the norm, then it's probably important to say something to that person, especially if it's a family member who is doing something like that. And we talked about culture, but just making sure you understand what your cultural norms are, and if you have family members that are part of a certain culture, and you're not part of that culture anymore, that they're going to experience the loss the way they're going to experience it, and you're going to experience the way you experience it, and both are okay. Um, Nothing wrong with that. We'll talk about this in a next slide, I believe, is feeling healing. So um, one of the things that I've noticed in people is some people um, do very well expressing their emotions, and it actually is healing for them to express whatever is going on in their life. And for other people, it's not. It kind of actually makes things worse for those people. And so I don't ever want to say, oh, you have to talk about something, because some people don't do well talking about things, and it makes them feel those feelings even worse. So when they're ready to talk, I'm open to hearing them talk, but to force someone into a position where they have to talk about something is not the. Um, I experienced that as well, feeling like when fresh a loss, especially my daughter's loss had happened. Felt like I was going crazy a little bit because the feelings were just so intense. They would come at such ferocity, and it just felt overwhelming. It kind of felt like I was drowning in an emotional response at times. And I've heard other clients say that as well. That it's like it kind of feels like I'm drowning in my own emotions. And so normalizing some of that and metaphors I found are really helpful for people to describe. So, like I said, my loss, it was like feeling like I was drowning in my emotions, or I felt like the tide was coming in and taking me and picking me up and carrying me. So, those are great metaphors for people to be able to describe. And it really paints a picture for them and for everyone else to know what you're going through. So, being able to be as descriptive as possible, I think, helps people understand what you're going through. And the age-old question: do you face your fears, or do you avoid your fears? Do you face those triggers, those things that tend to remind you of the loss, or do you just avoid them altogether? I don't know that there's an easy answer. I don't think there's a concrete answer for that. And you do what you feel is appropriate for yourself. If you feel like you can face a song that comes on the radio or whatever, and it's like, okay, I need to listen to this, then go ahead and listen to it. If you need to turn it off, turn off the song. And both are fine. I don't see either of those responses as being something that's a problem. Some people say it takes their breath away. Feels like I've been knocked over, drowning. I love when people can describe in a metaphoric way what their feelings are like or what their loss is like. Being able to predict a time frame, as I said earlier, very first the presentation, I don't like it when people predict a time frame when the grief will be over. The grief will be over when it's over, and if you continue to experience grief throughout the rest of your life, especially on holidays or their birthday or whatever, then that's okay. Nothing wrong with that. It doesn't mean because you've reached that acceptance. I love the acceptance phase of the 5 stages of grief, because we get there periodically and we stay there for a little bit, like, yeah, okay, I've accepted this is okay. But then it's not okay. Another moment, it's not okay. Another day, it's not okay. And those are all normal parts of experience and loss. Um, Journaling is a great thing. I love it when I hear people writing, especially writing a letter to their loved one. I think that's an excellent way to grieve a loss, is to write them a letter, share with them what your feelings are, share with them what you're experiencing. Keep the letter for future reference. Some people feel like, oh, I've got to burn the letter. I got to get rid of my feelings by burning a letter. And if that's what you feel like doing, I mean, I'm totally fine with that. But I think having a letter like that allows you to have a barometer in your life and to see months or years later, what you were experiencing and how much improvement you've made from that time. So I love it when people journal or write letters because it gives them that kind of frame of reference of what they were experiencing and how much progress they've made as they read those letters later on. Visiting the grave or having an urn in our culture is a great way to continue to deal with the loss. And I have a lot of clients say they go to the grave and they talk to their loved one at the gravesite or have an urn, and they spend time just being there and sharing their own thoughts or feelings. And they feel like just being there is supportive. And I 100% support that. I love it when people share stories, especially, and I've seen this a lot, right when someone passes away, people will share um, funny stories or um, different challenges that person had or whatever. And it's just great to talk. It's great to have people that share stories, and I would encourage people to write those stories down so that you don't forget those stories. It gives you, again, because years pass and we forget the stories of our loved one, and just having those stories is super helpful. Um, Kind of already mentioned this, but not allowing others to really grieve or influence our grieving. They can't tell us how to grieve. No one can tell us how to grieve except ourselves. But understanding when you're outside of the norm is really the key for those things. So one of the researchers I looked into was called, his name was George Bonanno, and he wrote a book called The Other Side of Sadness. I don't agree with all of his concepts. I will say that right up front. But I wanted to share them here because this is the other side. This is a different perspective on grief and loss. And he did some research on this. He did some studies on people that had experienced loss. And he says people experience loss every day. And this is normal. This is our norm in life, is we're going to experience loss at some point. His research showed that most people are resilient, and that there are no stages to grief and loss. People experience it in very, very different ways. And I don't agree with this. His research, he says people don't need to talk. Again, that part. I think people that feel like it's helpful to talk, I think it's very helpful. And I'm in the field of counseling, so I think it is helpful for people to talk. So, and I think where he kind of came to that conclusion is that he interviewed people that had experienced a loss, and then an interview a few years later, and found that time, the old adage, time heals all wounds. I'm not saying that is the case, but that's what his research showed, is that more than anything, time healed things versus any type of other intervention. And again, I don't agree with that, but that is the other side of some grief and loss. There was a Time magazine article years ago that they presented some myths, and interesting. This Time magazine article said myth number one was that we grieve in stages. So basically saying, he citing a Yale study where people yearn but don't experience anger or significant depression, but some people do. And so again, there are some. These are generalizations that aren't always applicable. Myth number two: express it, don't repress it. So the idea that we should express it. So they cited, interesting, Time magazine article cited George Bonanno's article of one of his studies of 66 people who said that they were worse off after they expressed their feelings 6 months later. So interesting, again, it's only 66 people in that particular study. So I'm not jumping up and down for 66 people and saying, yeah, that's a bottom line study or a groundbreaking study, but an interesting thing. And I agree with that. Some people don't do well expressing their emotions. In fact, some people, it does make them worse to express their feelings. But the question is, do those people repress those feelings? And is repression of those feelings a problem. And for some people, I would agree, I think it is a problem. Holding on to things that they should let go of can be an issue. Myth number 3, grief is harder on women. So studies showed that men actually had higher rates of depression after a loss than women did. An interesting sidelight there. I believe men experience just as much depression as women do. Men just don't talk about it. Men tend to suppress more than women do. Myth number 4, grief never ends. I think there's truth in both of these. Grief or remembering of that person and having those pangs of grief, I don't think that ever goes away. I don't think you ever say, I'm just over it. I'm done. I'm never going to experience sadness again. But the intensity and the frequency of those emotional responses may wane as time progresses. Counseling, and again, this is back to the George Bonanno study, which I don't support, is counseling is no more effective in time. I'm in the field and I don't agree with that, but I'm just trying to present things that, so that you guys have an altering view, another side of what grief might be. Okay, so what do we need? I think all of us need a support network. All of us need people that are going to be there for us. And some people just to sit with us. We don't need always someone to problem solve with us, just someone that can be there for us. And creating a list of activities, groups, or people that will support us. And when you're having a tough time, go to that list, have it written down somewhere. Because sometimes when we're in a not so good of a headspace, we tend to not remember some of the things that are our bread and butter. And so if we have a list of those things, we can just go to that list and say, oh yeah, when I was feeling this way before, I had this place that I went to that really helped me. Or this song that I listened to that really helped me, or, those type of things. And I think knowing what you hear from people so that you can kind of reinforce people to say those things that are helpful for you. So basically, when people are talking to you saying, I really like that. I like when you say that. That is so helpful. That is really supportive so that they really get an idea of what you need in those situations. So reinforce people when they're doing something that is helpful for you and tell them it feels good. I really like that. That's wonderful when you tell me those things. What can we do as a community? I think as a community and I'm on this kick of really trying to educate people that we need to move. Not that the 5 stages of grief are not helpful for some people, they are, but really move out of this model of people are going to experience 5 stages of grief and loss. It is just not the case, and let people grieve the way they grieve. Don't put them into a box and say, here's what you're going to experience. I remember after 9/11 happened, I remember one of the main networks had a psychiatrist, psychologist on who said the nation is going to go through these 5 stages of grief and loss. And I was like, no, I don't think so. I don't think everyone in the nation is going to experience the denial, anger, bargaining, depression, acceptance. It's some people will, but to say everybody is going to experience the 5 stages of grief and loss is a misnomer. Some people will experience some of those feelings. Some people will experience none of those feelings. I really like this. Don't ask to do something. I hear a lot of people say, and this isn't bad. I'm not knocking, and I do the same thing. It's like, because I don't always know what to say to people. Hey, whatever I can do to help you or support you, let me know. But if we know something that person needs, or we have a feeling to share something with someone, or just smile at them, or prompting to write something for them, a card or something, just do it. Don't ask for hey, would you like me to write a card for you, or bring you cookies over, or, that type of thing. Just do something for those people who've experienced a loss. And remember that the first few weeks can be the hardest because, as I mentioned, when those phone calls stop and the cards stop, and many people have moved on, that person who has experienced the loss is still experiencing the loss. And, not saying the meaningless or senseless things. I've actually heard people tell others, stop crying about it. It's time to stop whining. And, that's really harmful. That's not helpful at all to tell someone how they should feel or how they shouldn't feel. So those are some senseless things that I've heard. I've had people in my office who have said, man, my so and so said to me to stop being a baby. And I was like, man, that's rough. That's rough for someone to say that to you. So I just hope that we can, move on and move past some of those senseless things that people may say, but also be forgiving at the same time, making sure that, I think some people are just, not used to feelings and not used to being able to deal with things properly. And, so they say things that sometimes are pretty insensitive. So um, that's my presentation. I would love to entertain any questions that anyone has or thoughts you guys have about things.